All right, a very good morning to you. Thank you very, very much for keeping it locked on to Women Radio 91.7, Nigeria's first and only radio station for women and their families. Today is Thursday, day 21 in the month of March 2024. And a quick time check brings us to 9 minutes past 10 from the side of the radio. How are you doing today? I really do hope that your day has been a lovely one. Thank you very much for choosing Women Radio, WFM 91.7. My name is Blessing Agbeto. As always, I would like to ask you, I really do hope that you're doing your very best to stay healthy. Do you take care of yourself? Do you try as much as possible to, put your health into consideration wherever you do your stuff? Do you pay attention to the food you eat? Do you pay attention to your body system in general? I know as much as possible, as much as we try to emphasize on exercise and all of that, most times we don't get to talk about our oral health, and that is what we will be focusing today on the show. Thank you very much for joining me today on Radio Doctor. Radio Doctor is your free health consultation program where medical doctors advise real people. Radio Doctor is Nigeria's first specialized radio health program where medical doctors consult for free and advise on radio. And of course, it is broadcast from 10 a.m. Mondays through to Fridays. My name is Blessing Agbeto, and our Radio Doctor for today is Dr. Ezegwe Tobechukwu Joseph, a dental surgeon at Hilton Dental Clinic. Good morning, Dr. Tobechukwu. Good to have you on the show today.
Okay, good morning.
Good morning. Good morning. How are you doing today?
I'm fine. I'm fine, thank you.
All right, thank you very much for joining us on the show today. So yesterday was World Oral Health Day, and it is celebrated 20 March every year, and it is more like an opportunity for us to come together to unite to help reduce the burden of oral diseases which affects individuals. And this is exactly why we're having this conversation on radio for today to commemorate the World Oral Health Day. And Dr. Ezegwe Tobechukwu Joseph will be taking us through the conversation today. We'll be consulting and advising on dental caries. You can be a part of the conversation by calling us on 07000 917 917. Send us a text and a WhatsApp message on 0703 175 6537. Log on to our website www.wfm917.com. Download the mobile app, the VFM 917. Send us a text and a WhatsApp message on 0703 175 6537. And yes, remember, you can download the mobile app, the BFM 917. That is how you can be a part of the conversation for today. Once again, my name is Blessing Agbeto, and our doctor for today is Dr. Ezegwe Tobechukwu Joseph, and of course, he is a dental surgeon at Hilton Dental Clinic, and we're talking about dental caries today. All right, Dr. Ezegwe, I would like us to, kickstart the conversation this way. As a dental surgeon that you are, I would like you to enlighten us on what it means when we say dental caries. What does that mean?
Okay, thank you very much. Well, basically, dental caries has a more common, should I say, name that people refer to most times, and it's called tooth decay.
Oh.
Tooth decay. Yeah, so tooth decay is still dental caries. So dental caries is just a more professional term. Yes. So basically, dental caries, being also known as tooth decay, is just a process whereby the tooth gradually gets decayed due to some factors that are set into consideration. So the thing is, in dental caries, there are four key factors that need to be available for the tooth to decay. So the first one, which is the major one, is the tooth.
Okay.
So the tooth has to be present for it to be able to decay. So the tooth is a factor. Then the second factor is the substrate. And when we say the substrate, we mean sugar, refined foods, and others. When I say sugar, I talk of more of the glucose, sucrose family of sugar.
Okay.
So that's the second factor. The third one is the time factor, because the tooth cannot decay in a day. I mean, it's a dynamic process. It's over time, over several actions, onset of actions that it finally gets to the process where it decays. Why the fourth one is the saliva. Is the saliva.
Okay.
The microorganism itself is the fourth function. Other ones like saliva and others are just around it. They are more like they can alter whether the tooth is going to decay or not. So, for example, when we eat food and let's say I take something like chocolate, chocolate is sticky, or I take something like cake and it gets attached to my tooth. So the bacteria in the mouth, which are referred to as the normal flora, because everyone has a certain load or particular type of bacteria that are found in the mouth, they are referred to as the normal flora. So those bacteria are what act on the food we have eaten to form an acid. So that acid is what decays the tooth. So once the tooth is decayed, due to the acid effect on the tooth, as strong as the tooth is, it gradually starts decaying. So that decay process is, the softer it becomes, the more it forms a hole, a pitting hole, till it gets very, very, very decayed. It's now a wide hole. So you see, it's basically these factors that come together to play a role
in tooth decay. All right, thank you very, very much for your thoughts on the show this morning. 07000 917 917. That is the number to call to be a part of the conversation. 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. Log into our website www.wfm917.com. Download the mobile app WFM917. Sending your thoughts to our social media platforms, WFM917. That is the number to call to be a part of the conversation. All right, this is 17 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. And yes, you're listening to Radio Doctor. Radio Doctor is your free health consultation program where medical doctors consult for free and advise on Women Radio. Yes, it is broadcast Mondays through to Fridays, 10 a.m. through to 11 a.m. My name is Blessing Agwait, and our radio doctor for today is Dr. Ezegwe Tobechuku Joseph, a dental surgeon at Hilton Dental Clinic. And today on the show, we're talking about dental caries. That is what we're talking about on the show today. Remember, the phone lines are open for you to be a part of the conversation. Dr. Ezegwe, I really do appreciate how you took our time to, create more like a background to the conversation for today. I mean, you talked about how dental caries, a normal person would have been wondering, what is this one now that you're talking about? But I love how you totally, made it simple for us to really understand. And he said that it is the basic explanation is tooth decay. So when you say dental caries, you're definitely referring to tooth decay. And then he talked about the factors that are probably responsible for tooth decay. When you're talking about tooth decay, there are certain factors that you need to watch out for. And then he took out time to talk about the tooth. Without the tooth, there cannot be decay. And then he talked about the substrate factors. He also talked about time. He talked about microorganisms. According to him, there are other factors, but he said, these are the four basic factors. Once again, Dr. Ezekwe, I really do appreciate you for taking our time to enlighten us on this one. Now, I would like to ask you this one. You said something about time, which I totally think it means that maybe the older you get, the higher the risk of you coming up with or coming down with then tooth decay. So let's talk about the primary causes of dental caries in elderly patients. So we have older people who go through this process, and we also have younger people too who deal so much with dental decay and all of that, dental caries, tooth decay and all of that. So what would you say are the primary causes of dental caries in elderly patients?
Okay, thank you very much once again. Before I talk about the primary causes, there's something I want to break down a little bit more.
All right, please go ahead.
So you need to understand the primary causes I'll talk about. Okay, so first of all, I mentioned it earlier that dental caries is a dynamic process, meaning it can start as a decay and suddenly the process is halted or arrested, and the decay stops. Then if those factors, the bacteria and the sugar are present again, and probably the right time, where maybe patient is not brushing properly or something, the acid forms again and the decay continues. So it can be reversible. So there's a particular point to get to when it's irreversible. So we should just keep that somewhere in our mind, because something will still lead us to that later. Okay. So now, talking about the primary causes. Well, the major primary cause of dental caries is the bacteria. So this bacteria in the mouth is always there. It's always there. So, but they cannot function without the sugar or without the food. So the major primary cause is the effect of bacteria on sugar to form an acid to decay the tooth. So there are other causes that can lead to dental caries, but I wouldn't say they are primary. I'll say they are more like secondary causes. So sugar is so important that there were a lot of studies that have been carried out. I mean, somewhere in Sweden, they did these different studies where they worked on patients that had intellectual disability. So these people were fed with sugar. Some group of people in that hospital. It was a study they did why some people were not fed with sugar. And over a period of time, they found out that all the people fed with sugar developed decay in almost all their teeth. Why those that weren't fed with sugar, their teeth were fine and okay. To show you how sugar is a very big factor. Because everyone has microorganisms in the mouth. So what matters the most is diet. So one of the ways to prevent it is majorly that dietary modification. But since we've not gotten to the prevention, let's focus on the causes. So like I said, the sugar and the organism. So there are other causes. You know, some people can be immunocompromised, meaning their immune system is not so good or is not so strong. So in people like this, these organisms are more prevalent in the mouth, and they are always able and ready to act on the tooth. So different bacteria can cause it, but the commonest one is the Streptococcus mutans. So the organism is very virulent in the mouth, and it's the major causative agent of decay in the tooth. So it cannot be eliminated from the mouth, but it can be prevented, or should I say it can be stopped when the person doesn't feed the mouth with sugar. So there are other causes. For example, I would like to say in people that have reduced salivary secretion or reduced salivary flow. You know, the saliva has this effect of washing off or rinsing off food we've eaten without us knowing. It has this flowing ability to rinse off the food. So people will reduce salivary secretion. Most times when you eat, the food remains there, ready to be acted upon. So people who reduce salivary secretion can be more predisposed to dental caries than people that their salivary flow rate is within the normal range and everything is okay. So another cause is the poor oral hygiene. This is where brushing is important. So I always tell my patients that if you brush your teeth in the morning after you've eaten and you brush your teeth lasting in the night, that your likelihood of having dental caries has been reduced by almost 70% or more.
Wow.
So poor oral hygiene is and once you see someone with a poor oral hygiene, you're expecting to find at least 3 to 4 caries teeth minimum. At least 3 to 4 caries teeth minimum. So many other things. It plays a role. There are people on high dose radiation exposure where the salivary glands have been affected. And once the salivary glands are affected, saliva is not produced and the patient's mouth is dry. So when you eat, the food gets stuck. Sometimes they can even choke on their food because saliva helps in swallowing. So these people are more exposed, or it can still lead to the costs in dental caries. Then some other factors like smoking, alcohol have been known to play a role, but is not as significant as the sugar factor. So I think I should stop here.
All right. Thank you very, very much, Dr. Ezegwe, for your thoughts on the show this morning. 07000 917 917. That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703 175 6537. Log into our website www.wfm917.com. Download the mobile app WFM 917. Send in your thoughts to our social media platforms WFM 917. That is how you can be a part of the conversation for today. My name is Blessing Agbeto, and our doctor for today is Dr. Ezegwe Tobechukwu Joseph, and of course he's the dental surgeon at Hilton Dental Clinic. This is 26 minutes past 10 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there, tuned in today's dial. Thank you very, very much for being a part of the conversation. Radio Doctor is that radio program where medical doctors consult for free and advise on Women Radio. It is broadcast Mondays through to Fridays, 10 a.m. through to 11 a.m. Once again, my name is Blessing Agbeto. I hope you have been following the conversation. You can call us on 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. Log into our website www.thebfm917.com. Download the mobile app the BFM 917. Send your thoughts to our social media platforms WFM 917. That is how you can be a part of the conversation for today. So far, we've been able to establish the meaning of dental caries, and Dr. Ezegwe has been able to highlight some of the factors responsible. He has also gone ahead to talk about the causes of dental caries in elderly patients and in people. Now, I would like to ask you this one, Dr. Ezegwe. What are the early signs? Just before then, let's take this call. Hello, good morning. Hello. Good morning. Hey, Fodosagi, good to have you on the show. Even though the line is breaking. Yes. I'm really struggling to hear you. The line is really breaking. So, Osage, I know you can send in a text. Just do that. I'll read your text on the show because I'm really struggling to hear you. So just send me a text or WhatsApp message, and of course, I'll be able to relay your question to the doctor, okay? 07000 917 917. I wouldn't know why we're having these network issues. I mean, it has been on since the last night. Just keep your calls coming in, okay, for you to be a part of the conversation. I don't know if it's from your end or from our end, but then yes, let's just keep doing this as we proceed in the conversation for today. All right, so Dr. Ezegwe, let's talk about the early signs and symptoms. What are those things that would help us to know that, okay, this person is practically, battling with tooth decay or dental caries, as the case may be?
Okay, sorry, I didn't get you. What did you say? Can you come again?
So I said that you've talked about the causes. So now I'm asking you, what are the signs and symptoms that would help us identify that this person is, battling with dental caries at some point?
Okay, so in the cause of dental caries, there's what we call early white spot lesions. So most times it can be noticed more by a professional because there are other things that look like its initial stage on the tooth. So, but if the person is very observant, you can notice that there's a particular part of the teeth that appears whitish, like a white spot or dark, depending on how clean the person's mouth is, because it can get dark because of the stains by the food. It's not as if it's meant to be dark. So that early white spot lesion, when you see it on the tooth, is an incipient sign of caries. Once you see it, you know that the decay is about to start or is about to begin. And it appears that way because some minerals in the tooth has been lost by the acid. So it appears whitish on the tooth. Because that's one of the early signs. It's easier to notice it in children than in adults because adults, hardly do you see an adult with a decayed front teeth, unlike children that their decay can start from any point, either the ones in front or the ones behind. So yes.
All right. Thank you very much, Dr. Ezegwe, for your thoughts on the show this morning. I really do appreciate you. 07000 917 917. That is the number to call to be a part of the conversation. I would also like to know, Dr. Ezegwe, are there any specific risk factors for dental caries in the elderly population?
Okay. So, dental caries it's commoner in children. In fact, in America, dental caries was regarded as the commonest cause of chronic childhood disease. So that's how common dental caries is. So it's commoner in children because of their diet and their lifestyle. So they take more of the sugary things like Capri Suns. They chew sweets with their teeth.
You cannot mention brand. You cannot mention brand, doctor.
Sorry.
Yes,
sorry.
Go on.
They take more of sugary things. So because of this sugar and how they are not able to brush properly on their own, they are more prone to dental caries. Unlike the adults or elderly, where at some point in their life they reduce their level of sugary intake, so they are less prone to decay. But in cases where the elderly are still engaging in such lifestyle, then there is still a good chance to find decay on the tooth.
All right, 07000 917 917. That is the number to call to be a part of the conversation. 07000 917 917. Send us a text and a WhatsApp message on 0703 175 6537. 0703 175 6537. Log into our website www.wfm917.com. Download the mobile app WFM 917. Hello, good morning. Hello.
Hello, I'm with you.
No. We have a caller here. Hello, good morning. Hello, good morning. All right, do well to call us back on the show today. 07000 917 917. That is the number to call to be a part of the conversation. 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. Log into our website www.wfm917.com. Download your mobile app WFM917. Send your thoughts to our social media platforms WFM917. That is how you can be a part of the conversation for today. If you have any question for Dr. Ezegwe, please just send a text or WhatsApp message and I will gladly take it on the show, okay? 07000 917 917. That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703 175 6537. All right, Dr. Ezekwe, we have a message here. Let's take it. This one says, good morning, ma'am. Please, is it right to eat before brushing in the morning? And secondly, what are the ways to remove stains in the teeth? Dr. Ezekwe, over to you.
Okay, so I believe this caller asked two questions, so I'll start from the first one.
Yes.
Yes, so it is advisable to eat before brushing in the morning.
Wow, really?
That is if you have brushed last thing at night. So let me explain it properly so you understand. Let's take it the other way around, the way everybody does it normally. You wake up in the morning and you brush your teeth. That's the normal one we do. And after brushing your teeth, you eat. So after eating, the food is left in your mouth throughout the morning till afternoon, still left in your mouth throughout afternoon till night. And possibly you eat again in the night and leave the food in the mouth all through to the next day. So almost 24 hours, you have that food in your mouth. I remember we're talking about the substrate being available for the tooth to be decayed. So, but let's take it the other way around.
Okay.
Let's say you wake up in the morning, you eat your food, and then you brush. So after brushing, there's something in the toothpaste called fluoride. So it helps to fight against decay. It makes the tooth stronger and resilient to the acid effect on the tooth. So that tooth most likely is strong enough, or should I say more resistant to decay at that point in time. And most times, not everybody has lunch after taking breakfast. So your mouth is basically almost clean or okay till in the night when you get to eat again. And when you eat at night, you now brush again and sleep. So all through the night, the mouth is clean again. You wake up the next morning. But in a case where you don't brush at night and you carry the whole food in your mouth and want to eat in the morning before you now brush, you find out that the aim is almost defeated. So I wouldn't advise that. But preferably, it's better to brush after meal in the morning. If you try it, you will even enjoy the feeling in the mouth, knowing that there's nothing like food, there is no smell, nothing left hidden in your mouth because of that.
All right.
So the second question is how to remove stains. Okay, so removing stains is just about you visit the dental clinic where they can do what we call scaling and polishing for you.
Okay.
So after the scaling and polishing, if there are still some stains left, you can use what we call stain removers to remove the stains. That is if the stains are caused by extrinsic causes. When I say extrinsic causes, maybe like coffee stains, tea stains, or the type of food or things you eat like kola nuts or smoking stains. But if it's caused by an intrinsic stain, maybe people that have naturally yellow teeth, that is where you can now go into teeth whitening or teeth bleaching. So that's that.
All right. Thank you very much, Dr. Ezekwe, for taking our time to explain that to us on the show today. 07000 917 917. I see calls coming in. Please do well to send me a message on WhatsApp or as text for you to be a part of the conversation. The network is really funny today. Hello, good morning. Hello.
Good morning.
Yeah, good morning. Good morning. Hey, Yusuf Olamieko, I cannot hear you. As in, you know what? Just do me a favor. Send me a text, please. Send me a text or WhatsApp message on 0703 175 6537. That's the number to send your text to. 0703 175 6537. That is how you can be a part of the conversation. 0703 175 6537. Again, 0703 175 6537. That is how you can be a part of the conversation. So let me just know, what question would you like to ask on the show today? 0703 175 6537. You either send a text or WhatsApp message for you to be a part of the conversation, okay? All right, Dr. Ezegwe, we have this one as well. This one says, this is from Hayford Osagi from Ogbani. Says, please, can you help me ask the doctor if it is advisable to brush the teeth twice every day with break? And also ask him if there is toothpaste that can erase tooth decay. Okay, that one, he cannot mention brand on the show. And then he says, if one is having tooth decay, what's the solution? And then he said, doctor, what advice do you give for those addicted to cola nut? And that one is coming from Hayford Osagi. So that's more like 3-in-1 question. Over to you, Dr. Ezegwe.
Okay, so your voice was breaking. I think you can just tell me the first one.
All right, so okay, one after the other. Okay, so this one says, please, can you help me ask the doctor if it is advisable to brush the teeth twice every day with break, and also ask him if there is toothpaste that can erase tooth decay. And that one is credited to A4 Osagi. And I said that yes, you can answer his question without necessarily mentioning brand. All right, over to you, Doctor. Okay.
All right, so yes, it's very advisable to brush your teeth twice a day. It's okay as long as you don't use a hard toothbrush. Because if your toothbrush is hard, I don't know if you've ever used a hard brush to scrub the wall or the floors or a car tire. If you use that brush, over the years, you find out that the whatever you're scrubbing on is going to wash off or wear off. So when you use a hard brush and you brush your teeth twice a day, just in the space of 3 to 4 years, you're already having some pain symptoms because the brush is hard and it's wearing off the tooth. So it's advisable to use a medium texture toothbrush. So if you use a medium texture toothbrush, you can brush your teeth twice a day and you have nothing to worry about. So are there any ways to use a toothpaste to fight tooth decay? Yes. You just have to check the pack of the toothpaste. So if the toothpaste contains fluoride, most of them is written fluoride containing. If it contains fluoride, then you can be sure that this particular toothpaste is good enough. And these days, most toothpaste contain fluoride. But always checking.
All right, so and then he says, what advice do you give to those addicted to cola nuts?
Well, the truth is, cola nuts has been known to have some health benefits. And
wow.
I would not tell you to stop taking your cola nuts, but I can advise you to always remember to brush after, because cola nut gets stuck to the teeth and stains a major part of the tooth. So even if you would not be able to brush after, at least you can visit your dentist every 6 months so they can do the scaling and polishing for you, and those things can be removed.
Okay, thank you very much for your thoughts on that one, Dr. Ezegwe. It has been an interesting conversation, if you ask me, honestly. All right, 07000 917 917. That is the number to call to be a part of the conversation. Send me a text and WhatsApp message on the 703 175 6537. Log into our website www.wfm917.com. Download the mobile app WFM917. Send your thoughts to our social media platforms WFM917. Okay, so I have this one. I think you've mentioned this. I know you've mentioned this, but maybe you can address it further. So he says, what are the major constituents one should look out for in toothpaste for one having sensitive teeth? Thank you very much, Yusuf Olamilekon, for your message. So he's saying, for people who have sensitive teeth, what are those major constituents they should look out for in a toothpaste? And then he says, how do people with hereditary halitosis go about it? Hi, can you hear me, doctor?
Yes, I can hear you now.
Did you hear the question?
No, but I heard something about toothpaste.
So he's saying that for people who have sensitive teeth, are there major constituents that they should look out for when buying toothpaste? That's the first one. The second one he said is that for people who have hereditary halitosis, how should they go about it?
Okay. All right. So, for people that have sensitive tooth, sensitive tooth can be commonly caused by two major things. Number one, either the nerves of the tooth are exposed due to just your normal brushing habits, or probably you have sensitive tooth from the kinds of things you take, like maybe anything containing more of acid, citric acid, and all. So, like I said before, using the hard brush can wear off a part of the tooth, and the nerves of the tooth, I'm calling nerves of the tooth so you understand, are exposed. So these nerves, when they are exposed, you feel what we call sensitivity. So the treatment plan for it is either you use a toothpaste that can help to manage the sensitivity, or you come to the dental clinic. If it's due to wearing off the teeth of the tooth, then those places can be easily filled up with the sealing material. Then what are the ingredients you look out for? Well, the same way you check the back of the toothpaste, check if it contains fluoride. Most times you see sodium fluoride.
Okay.
You also check if you can see maybe potassium nitrate, or calcium carbonate, or strontium chloride. These are desensitizing agents. So it helps to reduce or coat those nerves, so the sensitivity reduces. It's just the way you use drugs for ulcer to stop the pain. It's the way you use this paste to stop the sensitivity.
All right.
Hello?
Yes, I'm with you. So, have you answered the other person that mentioned something about having hereditary halitosis?
Okay. Oh, and one more thing about this paste. When you're trying to control sensitivity, you don't just use it to brush your teeth. You actually apply it on all your teeth, hold it for some time, then you spit out. If you brush with it and rinse out, it will be less effective. Remember, its job is to coat those two. So the lesser the exposure, the less effective. So now let's talk about the hereditary halitosis. So for others listening, halitosis is called bad breath. It's also known as bad breath. So halitosis is a very, very, very wide or broad topic because so many things can cause it. But we have the dental or we have the oral causes. So one of the causes of halitosis for the dental causes is a decayed tooth. When a tooth is decayed, it forms a hole, and when that hole has been formed, especially in the inner tooth, food will go and pack and lodge there. Food of yesterday, food of last week, possibly food of even last year, because it gets stuck inside. And most times, the person would not want to brush that tooth because they are feeling pain. So when food of how many years ago is stuck in the mouth, it tends to smell. And when it smells, you say, oh, I have halitosis. So that tooth will need to be treated. The other cause is that when the person doesn't brush properly and food particles still get attached to the tooth to form what we call tartar or calculus or plaque, the gums get inflamed. And when the gums are inflamed, they bleed. That's why some people bleed when they are brushing. And they say, oh, I have bleeding gums. Most times due to the inflammation of the gums. So imagine it's a pinch of blood mixing with the food. And the mouth is closed over a period of time, probably throughout the night. When you wake up in the morning and you talk, you find out that there's this kind of bad breath that comes out of the mouth. So personally, I don't believe in hereditary halitosis, but I can tell you about the common things that can cause it. When you say it's hereditary, it may be relative to that particular family. Probably they engage in some diets that can cause bad breath. They engage in garlic foods, food containing a lot of onion or ginger or ODV. So these things can actually smell. So when everybody eats it and talks, it's as if, oh, this family has bad breath. Meanwhile, it's just the diet. Because what I've just talked about are the dental causes of this halitosis. So there are so many other causes. Some are even psychological. People believe their breath is bad and it's not. Then we have other causes from the GIT. Even peptic ulcer can cause a form of halitosis.
Wow.
Diabetes, mellitus, depending on the stage, and so much more. Liver disease. So there are so many things that can cause halitosis. That is when it's from the intrinsic causes. So for halitosis to be managed properly, you have to see the doctor. So if you meet the dentist first and he rules out every possible cause from the mouth, you now need to see a specialist of each of those regions or systems of the body that can possibly cause halitosis. But as for hereditary halitosis, no, I don't believe there is anything like hereditary halitosis.
All right. Thank you very, very much for your thoughts on that one, Dr. Ezegu. I mean, we still have a couple of messages here. Let me just run through them and hope we're able to take them on the show. This one says, good morning. My name is Michael. You talked about teeth whitening. What could be the effect of teeth scaling, polishing, and teeth whitening?
Okay, so scaling and polishing is just basically using a vibratory instrument to walk around the tooth. So when you use it to walk around the tooth, the vibratory motion is able to break off the dirt or the calculus being attached to the tooth. But when you talk of teeth whitening is a process where you apply a whitening agent or a bleaching agent to the tooth. So when this is applied to the tooth, it now acts on the substances that the tooth contains and makes it to be able to absorb more light, and the tooth appears whiter. So I'm sure this person is really asking about the side effects. Well, scaling and polishing, I would not say there are any side effects because you're basically removing the dirt. It's just like washing your clothes. But teeth whitening, when you do it over and over and over again, for example, you're doing teeth whitening over 2 to 3 times within 3 months or within 2 months, just because you want to have a really white teeth, you know that the chronic exposure to these agents can actually make you feel sensitive, like the tooth is going to be more sensitive. So what I mean by sensitivity is you feel this shocking sensation as if you took something really cold or something really hot. So the tooth tends to react that way. But personally, if whitening is done once or twice a year, I would say that is much safer than doing it.
Okay, once or twice a year.
Yeah, and there are other ways to have a whiter tooth. It mustn't necessarily be whitening, but then whitening is most commonly affordable, so that's the one people get involved in. But let me not go there.
Okay. Maybe another time we'll have deeper conversations about that. And honestly, I must say this is really interesting. I wasn't even thinking, when it comes to dental conversation, you want to think, it's just going to be, but I mean, this is really, really enlightening. So thank you for your time. Just before we call it a wrap on the show today, I want to ask you, this one says, good morning, doctor. Please, how can one clean a newborn baby's mouth? And what can be used for the cleaning? This one is credited to Mujikwe from Mera. All right, over to you, doctor.
Okay, so thank God this person asked this question because there's something I would love to point out here.
Okay.
So you can clean a newborn baby's mouth with a clean white towel, something similar to the one they put on their neck when they are feeding or breastfeeding. But
like
as long as the towel is clean, is white, is sterilized, you can just dip it in a warm water or a warm salt water, very diluted, and just clean around the mouth.
Okay.
Because the patient has come worried and like, doctor, my baby has white patches in her mouth. Hope it's not an infection or something. And it was just because of the milk had accumulated to that side and formed a whitish pattern around the cheeks. Okay. So just with the cleaning around, everything went off. So I'll use this opportunity to answer any question that wants to come from there. People ask, when should I start brushing my baby's teeth? Some people say from the child's first birthday. Some people say once the first tooth has erupted, you can start cleaning it.
Okay.
Yes. Then I would want to say people that breastfeeding mothers, or any caregiver that takes care of children, be it old, young, or the elderly, it's advisable to avoid putting our mouth in anything that the baby is going to take, because people will tell you dental caries is a communicable disease, because these organisms can be transferred from mouth to mouth. So imagine when you chew maybe meat when the baby is learning.
Okay. I see that you have a lot to say.
After chewing, this person chewing the meat has a decayed tooth, has these organisms present in the mouth. After chewing the meat, you give the baby to chew, and it just transferred that organism.
I know mothers do this a lot.
And the process can start from there. And some families will say, all of us in our family, we have that. But no, there are some other factors that can lead to it.
All right. Thank you very much, Dr. Ezegwe. Like I said, that's been an interesting conversation. I hope we get to talk about this some other time on the show, because I feel like there are so many things we need to know, particularly about what you just said now, because I know that in this part of the world, a lot of mothers like to chew and then they transfer whatever they've chewed into the mouth of the child. But we don't have time anymore. Thank you very much for being a part of the conversation today. I really do appreciate you. Do well to enjoy the rest of your day.
You're welcome. Thank you.
All right. There you have it from Dr. Ezegwe Tobechiku Joseph, a dental surgeon at Hilton Clinic. Thank you very much for your calls. I see your calls coming in. And of course, your messages. I do appreciate you. Radio Doctor on Women Radio, WFM 91.7, is Nigeria's first free consultation specialized radio health program on broadcast Mondays through to Fridays. Join us tomorrow at 10 a.m. for another Radio Doctor. Many thanks to the producer, Aisha Sani, and executive producer, Tom Okewale Shonaya. My name is Blessing Agbeito. Good morning, and do well to have for yourself a healthy day.
To sponsor this program, call the number 0816 480 7613.
WFM 91.7.